Good day, I welcome you back. Dr. Scott, your online headache doc, the only doctor of any kind certified by both the American and International Boards of Commonsensical Medicine. Welcome to Season 2, Episode 2, What Your Doctor Won't Tell You About Your Migraines, Your Headaches, and Your Ongoing Pain. Today we're going to continue from where we left off at the end of Season 1, and we're going to discuss one of the most important topics of the entire season, and one of the most important topics that we have discussed in my more than 31, nearly 32 years in private practice so far. And that is the two most common causes of migraines and headaches. And these two most common causes are not based on opinion. They are based on decades upon decades of proven, published medical and scientific research. And this is the biggest mistake that those of us that have battled or continue to battle ongoing migraines and headaches face. And that is, we keep trying things out, hoping for some kind of significant long-lasting relief, without first knowing and understanding what the cause of our symptoms really is. It defies common sense and logic, yet we as migraine and headache sufferers aren't given other options much of the time. The only option we're given is simply trying to find the next best new and improved pill, shot, potion, gadget, gizmo, something in another seemingly failing attempt to try to manage our migraine and headache symptoms. We're simply not given other options. And we've discussed, especially in Season 1, that opinions are plentiful. And opinions are simply that. And that includes our doctors, therapists, chiropractors. It doesn't matter what type of healthcare provider we choose to see. Each will have their own professional opinion. And the reason that we can't find any significant long-lasting relief is all of these opinions seem to differ, and much of the time they conflict. One doctor, one therapist will tell us, look, this is why you're having migraines and headaches. And the next doctor, therapist, chiropractor, practitioner will say, no, this is the reason. Who are we to believe? And it puts us in a terrible position as migraine and headache sufferers because now we don't know what to believe. So then much of the time we turn to the most well-known doctor on the planet, and that is Dr. Google. But once again, even though there's a wealth of information online, there's a wealth of conflicting information online. So once again, it puts us back in the position, the terrible position of trying to decide what's right, what's wrong, who is right, who is wrong. Is anybody even right? Is everybody wrong? That's not the position that we need to be in if we're actually seeking significant, long-lasting improvement. So, first thing I want to discuss briefly is among the medical community as a whole, what are the most common causes of our migraines and headaches? Well, this is going to be a brief discussion because among the medical community as a whole, and let me define medical community. It could be our primary care doctor. It could be a neurologist. And as you know from our previous season, neurologists are not migraine and headache specialists. It could be our chiropractor. It could be a pain management specialist. Among the medical community as a whole, there is no known cause of migraines and headaches. There isn't a known cause. They just, quote unquote, happen to some of us. Sure, there are lots of theories. Maybe they're hereditary. When I battled debilitating migraines for years, I was told, since another family member had migraines, that my migraines were simply hereditary and there was nothing I could do except try to find a way to manage my migraines as they continued to return time and time and time again, worsening in both severity and frequency as time passed. So, among the medical community as a whole, there is no known cause. However, much of the time, as we've discussed as well in Season 1, our doctors confuse triggers with causes. So, a trigger is something that will either bring on migraine or headache symptoms or aggravate, exacerbate your migraine and headache symptoms when you already have them. Some common examples: weather changes. Changes in the atmospheric pressure is much of the time called a cause of our migraines. It was caused not by a weather change, but it could have been triggered or aggravated by a weather change. And here's the reason for that. All of us experience the same weather change in the same region. I experience the same weather change as my office staff, or as my neighbors next door, or down the street. Yet, why don't most of them get migraines and only a select few do? Hormonal changes in women especially is labeled as a cause of our migraines much of the time. Well, once again, about 60% of my private practice comprises women's health issues and women's neurological and migraine issues. Yet, even though most women experience these hormonal changes, whether that's a monthly cycle or whether that's a pregnancy, most women experience these same hormonal changes, yet most women don't get migraines. Smells, sounds, lights, foods that we eat, not drinking enough water. There are so many triggers for our migraines and headaches, yet absolutely none of these are causes of our migraines and headaches. So, among the medical community, here are the two theories of why we get migraines or headaches. Number one, I don't know, they just happen for no apparent reason to some people. There is no known cause. Or number two, your migraines are caused by any number of triggers, yet most of us, the vast majority of the population, do not have migraines or headaches as the result of these triggers. These triggers are not causes of your migraines and headaches. So, unfortunately, this is the reason that we as migraine and headache sufferers are not able to find a long-term solution. If you don't know what the cause of the problem is, you're never going to find it and address it, and you're going to continue to battle migraines, unfortunately, sometimes for the rest of your life. It doesn't have to be that way. Common sense would tell us the only way to address migraines and headaches is focus first and foremost on pinpointing the real, true cause, or at the very least, the significant contributing factor to your migraines and headaches, and then, and only then, can your specialist put a treatment plan into place that's actually going to address this cause once and for all. Stop guessing. Stop allowing your doctors to guess. Stop allowing our doctors to experiment on us with the latest, greatest, new and improved pill, shot, or potion. It doesn't exist. It has never existed. And I've got news for you. It never will exist. You are not having migraine and headache symptoms because you haven't found the right drug yet. Now, here's the good news. If you are willing to do some simple research and review, even a small fraction of the decades upon decades of published medical research, here's what it will tell you. There is an identifiable cause for your migraines and headaches. There is a cause. There is a reason that you're having migraines and headaches. There is a reason that medication, if it does provide some relief, is very temporary and short-lived. Here's my concern as nearly a 32-year practicing migraine and headache specialist. We've been sentenced to a life of migraines and headaches by the medical community as a whole because there is no focus on pinpointing the cause. The focus is on treating and managing your symptoms for the rest of your life. You are now a lifelong drug-dependent customer of the pharmaceutical and medical industry, and I don't want that to be your only choice. Now, don't get me wrong, I work with some amazing medical specialists every single day in my private practice, neurologists at some of the most highly respected research institutions in the Midwest, some fantastic chiropractors, pain management specialists, primary care doctors, physical therapists. We need these specialists, but they must be used appropriately. Drugs are not the solution. Drugs are not the long-term solution for your migraines and headaches. Take note of this. The purpose of medication for those of us who have battled or continue to battle migraines and headaches is to help temporarily manage or treat our migraine and headache symptoms while the cause of the problem is being addressed. Let me say that again. This is the message that you need to take from the podcast today and share with somebody you know or care about that's continuing to battle these issues. Medication is not a long-term solution. It will not fix the cause of your migraine and headache symptoms. Medication is designed to temporarily treat or manage your migraine and headache symptoms while the cause of the problem is being addressed. Today, and we're going to continue this at least into next week and possibly into the weeks following, I'm going to discuss with you what are the two most common causes of migraines and headaches, and what I'm going to do in the weeks to come that I have failed and haven't done in the past is I want to discuss the published medical research that documents and proves these facts. There isn't a research study. There are hundreds upon hundreds of medical research studies that have been published, scientific papers that have been published, clinical studies that have been published. I myself have published clinical research dating back to 1993 in a peer-reviewed journal. There is an identifiable cause to many migraines and headaches, so why do our doctors continue to either ignore this research or, maybe more likely, why are our doctors completely unaware of this published medical research? Well, let me say this. If you're not trained to recognize the cause clearly you're not going to be able to pinpoint it or identify it when you see it. So, what I want to do next is discuss, according to decades upon decades of proven, published medical research, what is the most common cause of migraine and headache symptoms that has ever been documented in medical research, whether your doctor is aware of this research or not. The condition we term cervical spine kyphosis with spinal compression. Wow, what a mouthful. Cervical spine kyphosis with spinal compression or spinal canal compression. So, let me just say this simply. Your migraines and headaches may not be a head problem. Your migraines and headaches may not be a head problem. Now, certainly, we experience head symptoms. Let me define head symptoms. Headaches, pounding, dizziness, lightheadedness, feeling sick, vomiting, facial symptoms. Usually, a common place to experience these symptoms is behind the eye. Any of these symptoms can be caused by cervical spine kyphosis, or let's abbreviate it CK, with spinal compression. So let's define what is CK. When we view the base of your skull and your spine from the side on a side view X-ray study, your upper spine, the neck region, should form a nice forward smooth arc, a forward curve shape. And that forward curve shape acts as a built-in shock absorber, a built-in spring, so to speak, that protects your spinal cord. Let me say that again. CK is the loss of the normal forward curve shape, resulting in the upper part of your spine near where the base of your skull and your neck meet. So I want you to think of it this way. If you were to take your finger and begin bending it backwards, the wrong direction, and hold that pressure 24 hours a day, 7 days a week, not only does that cause pain, but that will result in damage to the joint of your finger, because obviously that pressure is not normal. Your finger is not designed to bend backwards, let alone be bent backwards with that constant pressure indefinitely. Cervical spine kyphosis, or the backward bending of your neck, the complete loss and reversal of that normal forward arch in your neck, which is designed to protect your spinal cord, is physically compressing and squeezing the spinal canal, which, ready for this, results in the most common symptom of migraines and many types of headaches. You cannot continue to compress the upper part of your spine or spinal canal, protecting your spinal cord, without having migraines and or headaches result. So, medical research has documented CK, the complete loss or reversal of the normal, smooth forward curve shape of your neck, as a primary cause of migraines and headaches for many, many decades, dating back even to the 1950s in some accounts. Look, we're in 2025, yet we continue to ignore hundreds upon hundreds of proven published medical research and scientific studies dating back to the 1950s and continuing to this day. Stop! Stop relying solely on professional opinions alone. Opinions vary. They conflict much, if not most of the time. You cannot rely solely on professional medical opinions when your doctors, number one, have differing and conflicting opinions, and number two, they're not even aware of the published research. I am begging you, please make your important healthcare decisions not based on opinions alone, but based on decades upon decades of continuing, proven, published medical research. This is the key to you finding significant, long-lasting relief from your migraines and headaches. You must become the expert. Next week, we're going to delve into not only the medical research that supports the diagnosis of cervical kyphosis, or CK, with spinal compression as a primary cause of migraines and headaches, but we will also move into the second most common cause of migraines and headaches, according to decades upon decades of proven published research, and not my opinion, not anyone's opinion alone, but based on published, proven fact. Please share this podcast with somebody that you know, somebody that you care about, that continues to battle ongoing migraines and headaches. Look, we're told that there isn't a solution, which is contrary to the medical research. If you are willing to become the expert, if you are willing to do a little bit of research on your own, there are proven, identifiable causes to your migraine and headache symptoms, and as we'll continue to discuss in our second season of Relief at Last, the Online Headache Doc podcast, there are solutions available, which we will dive into in much depth, and I pledge to provide you this season with not only the proven research to back up these facts, but simple, easy to follow, step-by-step guides to help guide you in the right direction toward living a happy, healthy, active lifestyle again, free from the limitations currently imposed by your continuing migraine and headache symptoms. Thank you kindly for listening. I'm Dr. Scott, your online headache doc, and those are the facts. And everything else, well, it's just another opinion. The information contained in this podcast is not meant to substitute for your doctor or healthcare provider's advice or recommendations. It is based on Dr. Scott's 32 years in private practice so far, specializing exclusively in migraine, headache, and upper spinal disorders, as well as decades upon decades of proven published medical research. Copyright 2025 by Milagros Media LLC, not affiliated with Dr. Scott's private practice.